And here we are. Here we are. We're live. We're officially live. Like last time, apologize for the fam and friends. The last time we put on a show, but we hadn't quite figured out LinkedIn Live yet. But I hope that you can see us now. So for everybody, welcome to another Hope, Power, and Healthcare with Chris Hemphill and my wonderful, fabulous co-host,
Reilly.
Melissa. And today is honestly a very special and deeply powerful and personal, impactful episode because we're on the intersection here on clinician burnout, an extremely prevalent topic as it is today. But we're looking at the intersect of burnout, art, and policy. You might not expect these things to go go together, but I'm joined by Dr. Jonathan Fisher, who has set up the Ending Clinician Burnout Summit. He's a cardiologist. He's going to go deep into the story behind that, and that's a way for people, not just clinicians, and clinicians aren't the only people in healthcare experiencing burnout. And the concept behind that is for everybody who can make an impact to come together and have a conversation about what they can be doing in their areas to alleviate the stresses and challenges of working within healthcare. So that's like that community building is an extremely powerful way to make an impact. And then also we have Jeremy Rosario, who is the mind and hands and heart behind the Disposables Project. And we're going to go deeper into that project, but there's a powerful name there. Disposables is in reference to the fact that this burnout issue results in people, unfortunately, taking their own lives, all kinds of things leading all the way down to a very grim pathway. And what Jeremy has done is taken disposed medical equipment and supplies and turned that into art that represents people that have died by suicide from these challenges. So that's actually had an impact on healthcare public policy as well. So we want to get into the whole story. But just to get started, though, Jonathan, introduction. Anything that you'd like in the form of like a little bit on your background and what you'd like for people to come away with.
Sure. I come from a medical family. So one of the largest medical families in the world, I've heard. My dad was the town doctor, and mom and dad had 7 children, and we all became physicians, just like my dad. And it was something that we grew up with. It was around the kitchen table, and I got to witness healthcare in the 1970s in America, 1980s, 90s, all the way through to today, where I'm practicing as a cardiologist, both in the clinic and hospital, emergency room, intensive care unit. And I also, because of my own struggles with burnout, before we were talking about burnout, before we had summits discussing them, before we had art projects honoring people who took their own lives. So many of us were just doing our job, so we thought, and showing up each and every day, trying to be perfect, trying to do good things for other people, not realizing that the system that we were working in was slowly destroying the thing that brought us to healthcare in the first place, which was our empathy. And my colleagues have big hearts, and I know each of you does as well. And so there was at least 10 years there, just into my career, where something was happening to me that I didn't really understand. I hadn't seen it described before, and I thought I was alone, and I actually felt ashamed. I wanted to rush through my clinic days because I was so exhausted. I wanted to get home. I would show up to work in the morning and realize that it was going to be hours and hours nonstop, and I had lost sight of why I had gone into medicine in the first place. So it was because of my own journey through burnout and just a chance message on LinkedIn in 2020, 5 years ago, from someone named Kelsey Trefethan, who she said, "I'm writing a thesis on burnout in healthcare, and I see that you've been posting about your own experiences as a doctor whose wife is also a doctor during COVID and what you've been facing. What do you think if we create a community?" And so It was back in 2020 that the idea for the Ending Clinician Burnout global community was born. And it was really because we knew that physicians and APPs and nurses and healthcare leaders had no space to simply share our stories, to share what it was like to be not a superhero, but a human being in modern day healthcare. And that's really partly why we're here today, as we're getting ready for our 4th annual global summit in November.
Well, Jonathan, I just want to say thank you for giving us so much in the introduction, and also just shout out to Kelsey, who's a fabulous human being. So anybody who wants to stay connected on stories with a very empathetic person who's part of the summit, I would encourage you to follow Kelsey as well as Janae Sharp. And Jeremy, we're going to focus more on your section a little bit later, but I'd love to hear from you about your perspectives and what you're hoping people walk away with.
Yeah, thank you. It's an honor to be included. From my perspective, I think there's a beautiful story about connection, intentional connection, and how when we become available, we can help save others. So really simple, but I can unpack that later. But thank you.
Well, thank you for that intro as well, and we'll get deeper into it. Yeah. I've noticed that there's a good number of people that have joined with us today to have this conversation. We were intentional about seeing some invitations, and if you have any questions, comments, stories that you would like to share, this is the place to share it. This is about not just seeing some talking heads on the screen, but fostering some kind of connectivity that we can from this conversation. But Jonathan, Melissa, any questions from you too? I've been hogging the mic all day.
Yeah, I love to see a eclectic but very innovative group come together, and it's so beautiful. With Hope, Power, and Healthcare, we do a lot of encouraging our innovators, people that are out there trying to better themselves, build something new into the future. And so I'm really excited to understand from both Dr. Jonathan and Jeremy, like what got you started on your mission of innovation? Like Dr. Jonathan, how did you decide that, go from, participating in someone's thesis to starting this summit that's now in its 4th year? That's just incredible. And Jeremy, same question for you. Like when I look at your art, it's just so beautiful. Like what gets you started on that path? How do you activate?
That is a great question because it really gets me thinking. And what I like about it is, as I think about the answer to why am I driven to help create this event and this community, along with Janae and Kelsey and Chris and Jeremy, so much of it is a direct reaction to my own experience with burnout. So the innovation, I'm a creative person. I've always liked kind of movie making and photography and a little bit of music here and there. But I think what happens in healthcare in particular and some other kind of techie scientific industries is that we're told very clearly that there is no role for creativity. In fact, you must follow the rules. If you're doing a surgery, you don't really want a lot of creativity. You want to have seen every scenario and be ready for it. And so there's a good reason for that, right? We have to have standardization of healthcare practices. Just like McDonald's is standard, you don't want to feel like your doctor's experimenting. But on the other side, until the time comes when we're all treated by AI-brained robots, we want to feel like we're humans being treated by humans. And that is a creative act. And so the reason I'm here and I'm driven to innovate and find new ways to broaden this conversation and bring more voices is because it's that absence of innovation, that stifling of the creative spark that drives so many of us into depression, into feeling like we're not fully human. And so for me, this is a creative act. I think that creating community, bringing people together is a generous and creative act. And it doesn't have to be that you make a full-length movie. Sometimes it's simply creating a space like you all are doing with this conversation.
Appreciate that. And Jeremy, before you jump in, I just wanted to say that that those are powerful words about creativity. Like we shouldn't be putting those types of skills on the back burner, because it's that kind of, that's stifling the fuel of innovation. So just wanted to I just really like what you had to say about creativity there.
Thank you. Yeah, great question as well. Creativity is it's just an amazing tool. It really allows us to feel different, to see empathy, to connect, to move, to educate, to inspire people. And I think at the genesis of some of this initiative, getting engaged, I'm working for FCB Health in New York City, and they believe in creativity as a powerful tool to solve some of the hardest things in the industry and in the world. So we can be changers for a positive future, if you will. And at the core of that, I think the inspiration is I also volunteer as a medical translator. And over the years, I've seen just the relentless passion and tireless efforts from so many physicians that show up to the clinic, Grace Clinics of Ohio, to help patients, and the joy that they feel when they're really caring for patients, even if they're extremely tired. And that to me became a powerful motivator to once we uncovered the piece of data that 1 million people are losing a physician. If you think about that, I mean, it's staggering. More than 400 suicides per year. And I, as an artist, and a communicator, I feel like what if that became the genesis and the North Star to really try to tackle something that is really hard to solve, but just to provide life, if you will. Yeah.
Powerful words and thoughts, and at the same time that we're focusing on connections and creativity, we're also getting a lot of questions from the chat about red tape, innovations in technology and things like that. Before we jump into that, though, Dr. Jonathan, I'm just curious about what when you were experiencing this thing that you didn't really have a name for, and that you really had a lot of shame for. Can you talk about the types of signs and tells? Could you talk about like what that experience was like, and what were some of those causal factors? I think that might help answer some of the questions that we're seeing in the chat.
Yeah, if you were watching me, you would have noticed something changing as I became a medical resident. I went to medical school for 4 years, and you were probably watching, a young man at that point who felt like he was at the top of his game, had studied chemistry and biology and physics and philosophy, and was ready to, heal people and make the world healthier and better, and filled with hope. And then if you followed me into my first year of internship and residency, the long hours, the lack of sleep. Ours was the very first year, I'm not going to date myself, but it was the very first year where there were laws passed that it was realized that doctors in training who were getting zero sleep were causing more medical errors. And so mine was one of the first years where we were permitted 4 hours of sleep. And there would be another doctor who would come on at 2 a.m. And so we would get to essentially nap or sleep between 2 and 6 a.m. And that, believe it or not, that was revolutionary back in the time. And so you would have seen someone who was exhausted, who was kind of irritable, frustrated. And I think the common theme, not just with me, but many of my colleagues who were burning out 2 decades before that was a word commonly used, is we were isolating ourselves. People said, hey, do you want to go out on the weekend and hang out? And I would say, no, I'd rather spend the weekend alone. And it became a turning inward as opposed to a turning outward. And it was that disconnection from other people that made things worse. And so you also would have seen a young doctor who would go into the clinic and would show up with all the tools, all the diagnoses and the physical exam skills. I was really good with my stethoscope. but I wasn't very compassionate. My natural compassion and gentleness had slowly been worn away by just exhaustion and feeling like I was in this and I wasn't clear anymore what the purpose was. I felt like a worker bee. So, Chris, those are some of the early signs that many high-functioning, well-meaning, purpose-driven doctors start off with. And through the years and through traumatic experiences where we may lose a patient or we may even lose a colleague, through those experiences, we start to lose a sense of hope and connection to the bigger picture of why are we doing this? We thought it was going to be something much brighter.
Dr. Jonathan, I feel like many of our innovator founders probably experience a lot of those same feelings as clinicians do as they start that early slog of starting a company. And so as you were experiencing all this and maybe not being able to put the right nomenclature to it, how did you lift yourself out?
It's a great question. And so how I did it is going to be different than how someone else does it. And I think we all fall back onto what our greatest resources were. And my greatest resource has always been curiosity. And so rather than wallowing too long in why did this happen to me? Why am I, going to therapy and trying to sneak in and out so nobody knows that I'm depressed? That I could have gotten lost in that, and I did for a while. But for me, the way out began with the curiosity to ask a question, and it was in the early days of Google. I Googled, how can I be happy again? Is it even possible?
I love that.
And that opened up a number of channels. The biggest one was a whole scientific field that I never learned about called positive psychology, which is not the psychiatry that I had learned about, why do people get sick? But it was the question of, what does it mean to live a good, full, and creative life? And how can we get that back? And I basically followed the instructions step by step like a good student. And after 10 years of that and reading every book, I then started to share the practices with my colleagues.
Dr. Jonathan, I'm looking at responses and comments like while you're talking, that there's an urgency to understand some of the causal factors here. Christy Brito asks about red tape. Manjeet Kumar asks about technology and AI potentially contributing to physician burnout. Yeah. You've had a lot of conversations and a lot of opportunity to connect with people. What would you say are some of the causal factors here?
These factors didn't exist when my dad was practicing medicine in the suburbs of New Jersey in the 60s and 70s. These are all a function of a few things. The convergence of private practices into owned practices so that the majority of physicians no longer work for themselves. So it's a loss of autonomy, and it's working in organizations that have to have policies, and you can call that red tape, if you will. A lot of that red tape came on as the electronic medical record and, quote, meaningful use came into play. And so what happens is you go to clinic, and in the old days, I might have seen a patient and had a pen and a piece of paper, and I would write my note and give them a prescription. Now, and this has all been counted, I have to do 4,000 clicks every single day, 4,000 clicks of a button. And not one of those clicks has any bearing on the health and well-being of the patient in front of me. And so not only is it frustrating and exhausting for me and 900,000 physicians who have to do 4,000 or more clicks a day, but it also creates a sense of a moral confusion. Like, is this why we went into this? To become clerics and secretaries and typists? And I think the answer is no. So that's a combined answer about the loss of autonomy, the growth of red tape, and the burden, the obstacle that the electronic record has become when initially it was set out, well, I won't give that much benefit of the doubt. In an ideal world, a computer and AI will be a facilitator of human-to-human interaction and not an obstacle.
So there's something powerful about the way that you phrase that, which is talking about a history where a lot of the issues that physicians today face didn't have to face in the past. Does that mean that burnout to the degree that it is today is a newer phenomenon that this is like there may have been issues in the past, but it's gotten worse?
So we can't know for sure because it was only in the 70s and 80s that Christina Maslach introduced the term into the academic literature and created standard criteria to measure it. And now most of us in healthcare well-being measure it very precisely. But even without that and removing any kind of biased lenses, it's absolutely true that burnout did not exist in the early days of healthcare for a number of reasons. Physicians got to practice the way that they thought was appropriate. They felt deeply connected with their patients. There were no insurance companies or middlemen in the middle interfering, and there were no kind of profiteers trying to insert technology and other things, not always for the benefit of the patient. And then if you look at the measurement of burnout over the last 3 decades, there has been a slow and steady rise from around a decade ago, 45% rate among physicians in this country, up to around 55 to 60% at the height of COVID. And over the last year or two, there's been a slight decline, closer to the high 40s. And of course, it depends on which of the 29 medical subspecialties we're talking about. But broadly speaking, there has certainly been an increase in this very new phenomenon of burnout in modern healthcare.
And Dr. Jonathan, you used a term in there that I haven't heard before. And it could be because I was raised through insurance companies, so I don't necessarily have the same lens that you may have, but you called it those of us in healthcare well-being. Can you click into what that means for you? And Chris, I hope we're in healthcare well-being. That would be great. It sounds awesome.
Well, let's figure out how. Let's make sure that we are.
So there is a trend, thankfully there's a trend now over the last 10 years, and some of this is because of the work of our former Surgeon General, Vivek Murthy, who wrote an advisory on well-being in healthcare, describing best practices. Some of it is researchers like Tate Schoenfeld, who was at Stanford, and others who have described best practices of how do you run a healthcare system so that the clinicians and team members have a sense of well-being, because when that happens, mistakes go down and patient experience and safety goes up. And I'm fortunate to I'm the physician executive for one of the leaders in the United States called Novant Health, and we have a dedicated team. And it's our Office of Well-being and Resiliency, and we look after 38,000 team members each and every day, finding out who's in trouble, who's at risk, who's doing well, and how do we go from good to great.
I'm sure Chris knew this, but I just love that. I think there needs to be more of you out there.
And let's talk about, you're working on it. I think that people in the audience want to work on that too. I'm seeing comments from folks like Abel, who's an insurance leader, Abel Luberton, on it's a great question. What are some strategies that you recommend to ensure that technology doesn't take away the human touch in healthcare? How do we find that right balance? And I like that question because we are at an age where we have a lot of decisions that we can make about technology. And I wonder if there are some decisions that we can make that can reverse that trend that you were talking about earlier.
Well, there are two very simple answers that come to mind that anyone can apply right away. And the first is asking the question, why do I want to introduce this technology, whether it's AI, whatever it is, a new billing platform? What is my intention here? Is it to increase revenue? Is it to improve the safety of my patients? Is it to improve the well-being of those who are going to be using these tools? And I think that simple step will often short-circuit the mistake that's been made by many in this space right now who are trying to find a place to use a tool rather than asking what problem is at the top of the list right now and how can we solve that. So that's the first thing. And the second thing is, like any good graphical interface or user design strategy, just have the people who are going to be using the tool design it, or at least be on the team.
Bring them in, yes. That hits just because a lot of people come to me and I'm really excited about the conversations that people have. and I'm not a clinician myself, but they're frequently asking for how can I get connected with clinicians to validate like this technology or product that I'm working on. So I'm excited to hear that you're opening the door for that kind of conversation and collaboration to happen, so that context is built into solutions people are building.
Yeah.
Also, another feather in your cap on this creating more wellness conversations. I'm looking at Evelina Stopka, who says, I'm so happy to hear Dr. Fisher in this well-being journey. I've just started my MSc in applied positive psychology, well-being, and health, and your experience makes me even more motivated to dive in. So thank you so much for sharing that, Dr. Jonathan.
Thank you.
Given that, like you've seen a wide perspective from from practicing to starting a summit and community building to leadership within the health system. We've been talking about the steer for innovators on the call, but could you talk about some of the things, some of the initiatives that you're most proud of at Novant and some other areas where you've implemented?
The approach is a fascinating one, which is, here's the question. You have a workforce that's caring for millions of patients, and the workforce has 40,000 team members. How do you make sure that each and every one of those individuals is feeling good, both mentally, physically, emotionally, and spiritually, within reason? And that requires listening. And so one of the things that I'm proud that we do is that we listen very carefully, both, carefully chosen, very simple to answer surveys and metrics, which people actually lean in on and answer. Traveling around and asking the question of all of our leaders, how are things? How are your teams? What's it really like? And then from there, just like I was saying before, not trying to introduce a solution or a program that isn't asked for, but letting the solutions for an organization emerge naturally from the problems that the people are actually facing. And so the things that I'm most proudest of, is that good English? I don't know.
It's very good English over here.
Yeah. So one of the things that I'm very proud of is that there's a program, there's a 6-month program in positive psychology and human flourishing. And I was fascinated that the number one class at Harvard and at Yale and all over the place is on human happiness. So if it's good enough for college students, what about for doctors and nurses? Why don't we learn that skill? And so I've designed that with our head of organizational psychology. And every month we have 300 to 400 of our team members together, and we discuss some topic around, aligning our values with our actions, working with challenging emotions, you name it. And then the other 6 months of the year, and I had our first launch today, I help people learn how to develop the skill of mindfulness and compassion, and really root everything we do in being fully present in this moment, aware of our feelings and others, and trying to bring values and compassion into every interaction. And I think for me, that year-long experience is something I'm very proud of. And the other thing that I'll point to, and pause there, is that my boss is one of the leaders of healthcare well-being in America, and he was among the first chief well-being officers. His name is Dr. Tom Janicki, and he had the concept over 10 years ago to take physicians and nurses who were struggling or not off site and lead them in a 3-day retreat, doing a full 360 of their whole life and looking at where they are in their life and where they want to be and helping them get there. It's kind of like an executive coaching program, and we've now led thousands of our physicians and our executives through that program.
That's amazing.
Well, thank you for sharing how these things work and how they connect, and the deeply personal nature, the year-long effort that it takes to really get down to the core and get people comfortable with what it takes to address these issues. Now, switching gears a little bit. Everybody, just a reminder, the Ending Clinician Burnout Summit, that's I think that Alyssa dropped a link in the chat. Thank you, Alyssa, for that. Our squad here, HPH 2025, gets you a pretty significant discount there. So that's just something that they've done to help with support there. The next topic that we wanted to jump into, and this is, I think, is going to be completely unusual to most people here, because this disposables project, Jeremy, whenever I first learned about it and saw your work, it just blew my mind, all that went into it. And I'm really excited about the opportunity to get deeper into something that this wasn't funded. This wasn't like some kind of initiative that came on high, but it's a passion project that's resulted in policy changes. So just to kick it off, would you mind giving us a tour of the gallery and taking a look at some of these creations here and talking through some of the thinking behind that?
Yeah, I'd love to. Let me walk around and then I'll dive in a little deeper into it.
Sure thing.
Um, so the disposables is a campaign that we have developed at FCB Health New York, and as a passion project, but it is a 4 portraits of doctors who have died by suicide. And we wanted to kind of use their portraits to kind of help break the silence of some of the current issues that are affecting physicians equivalent to burnout. You can see that every piece is basically a collage of medical objects that each of these physicians will have been touching within their own practices. Dr. Jolie, for example, he was an ER doctor, so you see IV bags and things that would have been accessible to clinician practicing in ER. Dr. Lang, quite large as well. So gynecologist, so you can see some of the items that she would have been touching as well. And so little tour of that. But at FCB, yeah, we pitched the idea once we got a deeper understanding on the root of the problem that is creating, and that is suicidality. So we wanted to kind of act and do something about it. And the idea became, what if we do the portraits out of discarded medical objects, almost like how a person may feel when you give your passion, your all, your soul into a career, and you feel like you're being discarded due to the pressures of practicing medicine. So as an artist, I can kind of share a little bit about the challenge. Number one is, where am I going to get medical supplies? And that was a lot of knocking on doors. Multiple places closed their doors and told me, hey, sorry, we can't do that. Contacting artists that work with trash too, to see if they will help us come along and create portraits. And after doors closing, I thought, well, what if I just take a stab at creating the portraits myself? And through a series of connections, I was able to begin getting some supplies from a local hospital, where the president of the hospital was able to come along to the studio, bought into the idea, and was very supportive. And in addition, I started calling doctors and nurses that I know, and they all told me, Jeremy, we lost another doctor to suicide in our practice. Yes, let me send you the supplies. And in the beginning became a little intimidating, because I wanted to capture the story of just amazing doctors. They had to look like them, but also being able to elevate the humanity in them, despite the really dark subject. And what it did is partner with Ohio State Medical Association, which at the time they were creating a confidential assessment tool for clinicians and physicians to be able to take that. And I think they shared with me the stat at the time, 2022, that the first 200 doctors who took the confidential assessment, 80 of them ranked high for suicide, in the red mark. So that kind of gave us a sense of urgency to say, okay, we creatively, how can we elevate the stories to really help break the silence and connect with people to get help anonymously. We launched the exhibit in partnership with the Ohio State Medical Association, advocating for the removal of invasive mental health questions from credentialing. And 2 weeks after the exhibit, the state of medical board, they took those questions out. So that was a huge win.
Can we zoom in on that a little bit? just so people have a perspective on the types of questions that are being asked, the stigma around those questions. Could you zoom in just a little bit on that, on what those questions are?
Yeah, it's a little bit of a moral injury, I guess. I mean, being able to, as Dr. Fisher mentioned earlier, having all that burden in your bag, but being afraid of losing your license if you knock on the door to see to get some help, from suicidal thoughts, um, and this notion of risking it all is something that a lot of physicians who have, again, just gone through long years of medical school, a lot of money behind it, residency, etc. Um, it's their lives are on the line there, So there's that true stigma of being able to step forward and seek help. Um,
And Jeremy, earlier,
yeah.
Dr. Jonathan talked a lot about that loss of autonomy, that inability to leverage their creativity. Were you all
Mhm.
seeing that as well in some of the suicidality, like in those moments? Was it, overworking? Was it, just not feeling like they, did you talk to the family members to start to understand maybe what led up, to some of these brilliant minds taking their own life?
Yes, and that's an excellent question, and just a really emotional series of conversations with family members. Um, you know, um, Dr. Fryman behind me, for example, I had started working on the project, and just to answer your question, after a conversation with his wife, um, I learned through Facebook that he had passed, and because of the topic, I was wondering, hey, I know Ryan. He's a phenomenal guy, very loving father, husband, amazing guy. Um, and the thought came through my mind, I hope it wasn't a suicide. But in fact, it was. And, I think, like many physicians during COVID, the extremely long hours, um, doing paperwork after you come home after 80-hour rotations and staying up to 2, 3 in the morning over years. I mean, it wasn't sustainable. Their burnout just did something to their brain. Dr. Lorna Breen, also, who you see in this portrait, a phenomenal physician as well. That if you read more about her, she got to a point of exhaustion. We couldn't even get up from her chair and practicing. A conversation with Dr. Jolie's family too. That I learned that he have asked the hospital several occasions for a break, for a sabbatical, and it was denied. And so that gives you a little bit of
Mm.
a perspective of the real challenges of that are affecting our brightest. And so the purpose of the campaign really is not to point fingers, but instead just break the silence to begin building a better future of hope for for all our doctors. It's our time to fight for them. They are healing our communities, and I feel like population, we need to fight for them.
When you present this work, which I'm just floored by the fact that you have such a deep personal connection with the people that you're portraying here. Is there a certain perspective, or is there something that you're hoping connects with a viewer in some kind of way? Like, what are you hoping that people see when they look at these things?
So the I want them to see the humanity behind the physicians, but also the idea that recovery is possible from burnout. And I have a nice evolution of the story of the campaign. I took it to several hospitals in the state of Ohio, Tennessee, and Chicago. And when people walk up to them, there's not a dry eye in the room. It's really, really incredible what happens. I think with the deep connection that a lot of doctors have to the work, they most of them share, the similarities within the story. And I think that being in an equal plateau within their careers is what makes it so moving for them. We when we launched the exhibit, I'll just tell you a story too about what a positive story that came out of the initial uh, exhibit. One of the trauma surgeons that I had invited, he saw the work and took some material to work, and shared with other doctors. And one of them was Dr. Valdez, which we have a video in our website, disappearingdoctors.com. But it's a story about how we all have the ability to check on each other, connect, and the fact that he went to this exhibit, she felt very open about her current journey, and she felt like she could trust him. And through a series of conversations, he didn't know she was suicidal, and she got checked in the PHP in Ohio, and she's doing beautiful recovery now. But she has been a huge advocate too of breaking the silence and helping inspire those who are struggling in silence. So I encourage you to take a look at the video and go to the website as well to learn about this.
Chris, and Jeremy, if I can add an interesting
Yeah.
historical context here.
Hmm.
So, we take it for granted that these changes that Jeremy, you've brought a lot of this about with your artwork, and people say, well, what can art actually do? And it hits people in places and ways that, let's say, a 20-page document might not hit them. And I'm curious if I can ask a question,
Yes, certainly.
how have you found the difference between the way that art communicates and helps bring about change versus the more traditional ways that people might think, oh, you have to write an article or you have to do some kind of a detailed analysis or show statistics? How do you think about that?
It's a it is interesting because it's a different way of connecting through creativity and how it can touch the hearts of people. Um, in this scenario, I mean, the campaign was based on a lot of data, but leading just with data points, it wasn't enough. You have to find a way to really move people based um, on that emotional direction to create change. And to give you an example, I think that the exhibit, the disposables, when it was launched, it wasn't only about the art. The art was just a tool that brought people together to solve a bigger problem. And we had a couple of speakers in there, like the surviving spouses telling the story to the head of the medical board, to policymakers, and having everyone who was had the ability to make a change in the same room. It became a unifying force, and which goes back to something that I mentioned earlier, that it's such a complex issue with moral injury and administrative burden and other things that are happening, that I'm hoping that we can continue chip those little things away to create a better future for it.
Well, the interesting part there, Jeremy, is that how rapidly this change has happened. So when I was a medical student and even a young doctor, every year I was asked questions by the hospital board and the medical board. Questions like, have you ever been treated for anxiety or depression? And I had been treated for anxiety and depression. And I wasn't alone, because I know it affects 10 to 20% of all physicians. So how do you think that impacts the average doctor who has to answer the question? Some of them are on the wall behind you. Many of us would lie. Many of us would hide, because the potential implications of having that diagnosis, we didn't know. Maybe we would lose our job. Maybe it would be publicized in a way that it would affect our standing. So that amount of shame was created by the questions that were being asked, by the organizations that we were working for. And what I find very hopeful is that all of this was in effect up until 5 years ago. And it was really in Virginia where Lorna Breen, who's right over your shoulder, her brother-in-law, Corey Feist, who is an attorney there, as you know, you've worked so closely with him, he took up this battle, and he took it all the way to Congress. And now, 5 years later, gradually, we have almost 37 state medical boards who've changed their policy, who've abandoned all of the shame-inducing, stigma-inducing questions and focus only on questions that matter, which is, are you currently struggling with something that has a negative impact on your ability to deliver care? If it doesn't affect your ability now, it's not relevant. It can only create problems. So I wanted to add that compressed historical view because this is a really uplifting, inspiring part of the story.
Go ahead. No, I just wanted to mention about, just real quick, every background is different. And Dr. Breen's background, they're angel wings made out of surgical mask, because I almost thinking, she's our angel, trying to make that better change. So that's it. Sorry.
Oh gosh. So I would on the website or where people can access it. Does it have explanations on some of the thinking behind the materials and their relationship to the people that you're portraying?
Correct. Yeah.
So it should be clear now. It should be 100% clear about the potential impact that art can have. Working alongside Jeremy, you said it was a very data-driven campaign as well. So these things both have a place to live and be housed together. And thank you, Jonathan, for emphasizing that like that resulting impact of those questions being removed. It does make me wonder, Jonathan, that there was a point that you brought up earlier about the trend line going up for many years, but now seeing a slight downturn. I'm wondering if you've done any investigation or see why there's a downward trend in that burnout movement.
And gentlemen, that question is what he asks everyone who brings up any type of trend line conversation. Our data scientist always wants to interrogate the data, so that's really what he's asking. It's always going to happen.
Yeah. I don't think we have all of the facets of that question fleshed out. I think some of it was that there was an amplification effect of COVID itself, which we sort of saw that breathing space afterwards. I'd like to think that some of this is the acceleration of the well-being movement happened as a result of COVID. So a lot of horrible things came from COVID, but the one thing is that it pointed out the cracks in our system. And healthcare systems across America and around the world really realized what they were missing. They weren't looking after the well-being of the people who were actually now dying in order to care for others, literally dying. And so I think some of that reduction is a real acceleration of this focus on the well-being of nurses, doctors, APPs, and team members, including universal provision of mental health support for people who may be either on the verge of suicide or suffering quietly from anxiety and depression. Our healthcare system, and so many now, have as a standard practice free access to some form of mental health, whether it's in person or by an app. We've introduced kind of peer check-ins, which in the height of COVID, where we were so isolated from others that we created these ways to connect with colleagues just to shoot the breeze, to help with that loneliness. So I think it's a combination of the relief of the pressure of COVID, the growth of these well-being programs and initiatives, and I'm sure there's some other factors there.
And so thanks for helping make that more clear. And I had well, actually, there's one that came in from the audience. I can't ignore this one, but it came from Brian Green, and it's about other clinician groups, nurses, ancillary healthcare providers, etc. Just wondering about the space for those conversations and other people outside of the MDs and DOs and things like that are experiencing burnout as well in the medical profession.
Is it a question of which groups are involved in this conversation?
He was asking about who else is reaching out and what the involvement is with ECB.
So, I mean, there's two parts to that. One is just in general taking, our community, ending clinician burnout, global community out of it for a second. Every healthcare board and community now has some wing or office or person who's looking at the well-being piece, whether that's the American Medical Association, American Psychological Association, American College of Graduate Medical Association. This is now what we used to talk about healthcare, these sort of three foundations of healthcare around patient safety, well-being, outcomes. But now it's the provider side that's the fourth pillar of healthcare. And so this is part of any respectable leadership group has to address the well-being. And in terms of ECB, our group, Jeremy's group, FCB Health in New York, was really our first partner 4 years ago. When we started this, it was just a dream, and we overdid it. We ended up with 3 days of ongoing program for hours every day in 3 simultaneous Zoom rooms, each one moderated by a different facilitator who was a volunteer on our team. And we ended up having 84 speakers from around the world with 1,000 participants and attendees. I got to interview Ariana Huffington, Dr. Jim Doty, who passed away this year, who's a pioneer for compassion in healthcare. And so FCB Health, people don't know this, if you look at our website and our design and all of the beautiful programs, that's been Jeremy's team, doing it out of the love of their hearts because they believe in this movement. And I think for me, that gets back to, we know the data and the statistics, but sometimes it's the simple things. It's the visual ways that we communicate that just gets you in the right place. And so I want to just offer a huge thanks to FCB Health and Jeremy, you in particular, your incredible team who's been with us for years in this movement.
Well, thank you. It's been just an amazing team. We're honored to support you with Justin, Gabby, Mike, everyone in the team who have kind of led the effort.
Well, it just seems like you both are bringing so much light into a space maybe filled with struggle and loneliness. And so we just congratulate you both. It's incredible.
Yeah.
Jeremy, I did have one more question for you, which was just producing these artworks and seeing the reaction to it and then seeing change in policy directly attributed to that. What has that taught you about the intersection of art and advocacy?
Wow, great question. So it has taught me something that I think Dr. Fisher summarized really well. I follow all your posts. Resilience doesn't come from paving the road, but from changing how we walk it. And I think that it has taught me that, in my own humanity, sometimes I may not think that I can contribute and make some change, but get involved, get engaged. Reminds me sometimes life could be like hot water. And who are we? Are we going to be a carrot that walks in to the water and gets soft, or a hard-boiled egg that is soft and it gets into the water, gets hard? But no, I think as a good Puerto Rican, we like coffee. We have to be coffee beans. You get in the water that is boiling, change the flavor around it. And so that's what I want people to walk away with. Yeah.
That's so huge. That's so huge. And we've got another question from Brian Green.
Sure.
AI governance and ethics leader, by the way. Like, I want to emphasize this isn't just clinicians. These are all kinds of different innovators that are curious about how to make an impact. But Brian was just wanting to know about your book, Just One Heart, and if there's best practices, like things that people can follow from some of your publications.
Well, Brian, thank you. I promise I didn't pay Brian to mention my book, but Melissa, maybe we could put a link, the Amazon link to Just One Heart. I spent 2 years researching best practices for ending burnout, but I didn't want to create something that was kind of an organizational roadmap. It's more for individuals who are struggling, specifically for people who care about others and at some point along the road have lost that ability to care and didn't realize that there are all these forces around them. So it gets back to what Jeremy said. It was a post that I worked on last week, which is that we could either do like the parable of the king who his feet hurt because everywhere he walked there were stones. He ordered all the people to put carpet everywhere around the whole earth. And it's like ludicrous to try to expect healthcare to change for us. Sometimes we have to start within ourselves. And so Just One Heart is this process of just learning to put our own shoes on so that we can walk into any space and tap into our greatest resource, which is our human heart and our spiritual heart and our emotional heart. So thanks for asking, Brian.
So, Chris, I have a question in terms of, okay, all this amazing things have been happening for both of you and you're lifting up the world. What's next?
Jeremy, Chris?
Great question. What is next? I have some additional passion projects that I want to pursue, and one has been something that I started with my daughter, the ABCs of Encouragement for Girls, and it has to do also with mental health and how 2021 we saw an increase of suicidal attempts from teenage girls between the ages of 11 through 14, including some girls in our middle school and high school, were in our school district. So I want to continue taking that into the next level, which is, we have gone to schools and trying to encourage the next generation of really strong women. Outside of that, there's a couple of other projects too that I'm brewing right now. But again, it's something that I have to do nighttime and weekends, but creative aspects also.
Amazing.
Keep us in the loop as you produce these. We want to share them
cool.
and promote them as much as we can. Thank you so much.
Yeah.
Yeah,
Actually, I have a few. Yeah, let's see. A prototype of the ABCs of Encouragement for Girls.
Wow.
And
Yay.
it's one of my favorite letters, for example, will be brave, do the right thing even when you're scared. I think it becomes just a conversation tool for any caregiver to be able to unpack any of this truth. I mean, I'm sure everyone here had a time in their life when you were really scared and you had to be brave, but sharing those unique stories from your heart to a young girl, that will stick with her forever. I still remember my conversations with grandma when I was a kid, and when I faced difficulties later in life, I realized, this is if grandma could do it, I'm on it too. So
And Dr. Jonathan, what about you?
Oh, without going into any specifics of what I'm doing, I've got a dozen projects. I think for me, I'm trying to think about what will my legacy be, and rather than what can I achieve. And I think the legacy is about how we can care for our hearts and care for other people's hearts in every sense of the word. And so whatever project I'm doing, it'll relate to care and the heart and leading others with our heart and from the heart.
I just got that because you're a cardiologist. Yes. Took me a moment. Yes. I love it.
Y'all brought such heart and soul into this conversation that leads us to have to take a mirror and reflect, like, well, what's going into your heart and soul? How is art impacting you? Pop culture, books, movies, music. What's been on your what's been on your list lately? Starting with Jonathan.
I just got back from one of my favorite weekend trips, which was New York City, and we went to see jazz at the Birdland, and it was Charlie Parker's birthday. So I try not to get lost in my head when I'm experiencing art and music, and we were in the Metropolitan Museum the next day. And what really continued to strike me is that, there's two different ways to play music. There's the orchestra, and everybody plays exactly the right notes, and then there's jazz. And I'm loving being in spaces like this with you all, with Jeremy, where it's a bit more like jazz, and you don't quite know what it's going to sound like until it comes out, and it's usually beautiful if everyone brings their best. So that's the latest art that's on my mind, and then the other piece is that Noah Wiley, who I grew up with on the show ER, this year came out as the star of a show called The Pit. And so many of us felt like he and the producers and the writers are in this work with us. They're doing the work, which is showing what it's really like in a way, including the politics and, some of the darker parts of healthcare. So highly recommend The Pit for anyone who hasn't seen it yet and is interested in this conversation.
Thank you so much. And what about you, Jeremy?
I'm in a season of life right now where we have been really busy with sending kids to college, kids moving out, downsizing. So I haven't really been able to read anything. But one thing that I've been a little more intentional with in order to get inspiration is spending time with people and not saying no to a cup of coffee or come over for a meal, even if it seems a little um, not planned. But I think that spontaneous aspect of doing life is fueling me with creativity, just to listen to conversations, connect, see what is inspiring people and listening.
Not having everything filtered through an app, like like the real conversations and stuff like that. Maybe this one, maybe LinkedIn Live is a good enough one. But like I love
Yeah,
I love where you're coming from with that.
And free living, yes.
yeah. You know, through some of those conversations, one thing that I love asking people is, if today's the last day you see me, what words of wisdom will you tell me? And it's just usually unpack some
Mm.
beautiful things to generate a
Mm.
nice conversation. So
Oh,
reach
we should
out
close on
to
that.
any.
That's great. Yeah, I
Yeah,
love that.
yeah.
We can't dodge it, Melissa. Though, what's yours?
Okay, so I am debating going to Reese Witherspoon's Shine event. I just finished. It was just a pleasure reading book this weekend. It's probably the first time in like 2 months I picked up a pleasure reading book that wasn't industry related, and I read her Emily Henry pick Big Beautiful Life, and it was great. It was just a lighthearted,
Mm.
um, see my heart joke there, Dr. Jonathan. It was a sweet little book
That's great.
about two writers, and they fall in love while writing a story. And I was like, oh, this was cute. I loved it. It gave me so much hope. I'm going to try to work in another pleasure reading book next month.
That's cool. And like the recommendations you have on books and TV, and they're all been spot on. So keep us in the loop on that stuff too.
Chris, we can't leave without hearing what you're listening to.
I got some friends in Birmingham, Alabama that are just doing the thing when it comes to music. It's this group called Iron Giant Free Association. And Jonathan, when you brought up that musical experience in jazz and everything like that, there's this piece of like kind of avant-garde, cutting edge type music from the 70s called NC by Terry Riley. And they picked that up, and it's a crazy piece because it never ever sounds the same whatever orchestra is playing it. Like it's designed so that like the people that are reading the sheet music, it tells them go to this section whenever you feel like it at your own leisure. And what happens is like you have like 20 musicians up there, and while they're going through it, like they hear, oh, the person with the flute is doing this, or this person with the synthesizer is doing that, and they start forming these really interesting connections and stuff like that. And the recorded experiences of NC are all different, but it's fabulous. Iron Giant, they did, and again, I spent 10 years in Birmingham. These are my friends. I love these people, but they came out with what I consider, and obviously my opinion is biased, but still what I consider the best recording of Terry Riley's NC. It's on Spotify. They put a lot of work into producing it and making it like it was originally like a classical piece of music. They took it to jazz, soul, ambient, electronic, like they took it everywhere. And it just blew my mind when I heard it on a run a couple of weeks ago.
We're not going to sleep on this.
Amazing.
Seriously.
I guess we'll throw it in the Hope, Power, and Healthcare playlist.
We have to. Well, huge thank you, gentlemen, for being a light and an inspiration to the fam. I learned so much about burnout and ways to prevent it. And, thank you, Jeremy, for your beautiful tribute to our healthcare heroes.
Thank you.
Everything
Thank you
they
for
all
the
do.
invite. Yeah.
Yeah. Oh, sorry. Yeah. Yeah. Everything y'all do, like at this intersection, art, policy, burnout. Like, if you were struggling to see the connection, why this thing was called, what it was called, I hope you see it now. But with that, y'all, please feel free to stay in touch. Stay in touch with each other. Everybody on LinkedIn, like follow each other. You're friends now. You're in the same pod, same fam. And if you want to take it even deeper, come to our Discord. It's been a slow rise, but it's been good. It's been
And
good.
another app that Chris loves, yes.
And
Thank you all
join
so
us
much.
Yes.
and join us
Oh,
on
yes.
November 6th and 7th.
November
Yeah.
6th and 7th, HPH 2025, y'all, 25% off of the
Like and share.
Yes.
Yep.
Thank y'all.